Are you aware of cancer screenings? And what are the risk factors you should know? Turning 40 is a milestone birthday, and it's a time to start thinking more seriously about your health. That includes getting regular cancer screenings. Cancer is the leading cause of death in people over 40, but many cases can be detected early and treated successfully. Cancer screenings after 40. Breast cancer screenings. Mammogram. A mammogram is an X-ray of the breast that can detect breast cancer early. It is recommended that women ages 40 to 49 get a mammogram every year or two, depending on their risk factors. Women ages 50 and older should get a mammogram every year. MRI. An MRI is a type of imaging scan that can be used to create detailed pictures of the inside of the body. It is sometimes used for breast cancer screening in women with a high risk of breast cancer. Breast cancer is the most common cancer among women, and the second leading cause of cancer death. While the exact cause of breast cancer is unknown, there are several risk factors that can increase a woman's chances of developing the disease. What are the risk factors of breast cancer? Age is one of the most significant risk factors for breast cancer. Most cases being diagnosed in women over the age of 50. Family history. Women who have a close relative, such as a mother, sister, or daughter, who has been diagnosed with breast cancer are at an increased risk. This is because certain genetic mutations can be passed down from parent to child. Personal history. Women who have already had breast cancer are at an increased risk of developing it again in the other breast or in another part of the same breast. Dense breast. Women with dense breasts have more breast tissue and less fatty tissue. This can make it more difficult to detect breast cancer on a mammogram and can increase the risk of developing the disease. Other risk factors for breast cancer include being overweight or obese, having never been pregnant or having your first child after age 30, having a personal history of certain benign breast conditions, drinking alcohol, smoking, exposure to radiation. Cervical cancer screenings. Pap test. A Pap test is a test that collects cells from the cervix to check for precancerous changes. HPV test. An HPV test is a test that checks for the presence of the human papillomavirus, HPV, which can cause cervical cancer. The American Cancer Society recommends that women ages 30 to 65 get either a Pap test every 3 years or the HPV test every 5 years, or both tests every 5 years. Women who have been vaccinated against HPV and have no other risk factors for cervical cancer may be able to stop screening after age 65. Cervical cancer is a type of cancer that develops in the cervix, the lower part of the uterus that connects it to the vagina. It is the fourth most common cancer among women worldwide, and the second leading cause of cancer death among women in developing countries. The main risk factor for cervical cancer is infection with the human papillomavirus, HPV, a common virus that can be transmitted through sexual contact. Other risk factors for cervical cancer include smoking, a weakened immune system, having multiple sexual partners, using oral contraceptives for a long time, having a history of sexually transmitted infections, STIs, such as chlamydia or gonorrhea, being exposed to diethylstilbestrol, DE, a synthetic hormone that was given to some pregnant women in the 1950s and 1960s to prevent miscarriages. Join our community and never miss out on new content. Subscribe today. Colon cancer screenings. Colonoscopy. A colonoscopy is a procedure in which a thin tube with a camera on the end is inserted into the colon to look for tumors and other abnormalities. It is the most effective way to screen for colon cancer. Cologuard. Cologuard is a non-invasive test that looks for DNA from cancer cells or precancerous polyps in the stool. It is not as effective as a colonoscopy, but it is a good option for people who are unwilling or unable to have a colonoscopy. The American Cancer Society recommends that people at average risk of colon cancer start screening at age 45 and continue screening every 10 years. People with a high risk of colon cancer may need to start screening earlier and more often. Colon cancer is a type of cancer that begins in the large intestine, colon. It is the third most common type of cancer in the United States and the second leading cause of cancer death. The main risk factors for colon cancer are age. The risk of colon cancer increases with age. Most cases are diagnosed in people over the age of 50. Family history. People who have a close relative, such as a parent or sibling, who has had colon cancer are at an increased risk. This is because certain genetic mutations can be passed down from parent to child. Personal history of colon polyps. Colon polyps are small growths that can form on the lining of the colon. Most polyps are harmless, but some can turn into cancer. People who have had colon polyps in the past are at an increased risk of developing colon cancer. Inflammatory bowel disease. Inflammatory bowel disease, IBD, is a group of conditions that cause inflammation of the digestive tract. People with IBD, such as Crohn's disease or ulcerative colitis, are at an increased risk of developing colon cancer. Unhealthy lifestyle. An unhealthy lifestyle, such as smoking, eating a diet high in red and processed meats, and being overweight or obese, can increase the risk of colon cancer. Lung cancer screenings. The American Cancer Society recommends lung cancer screening for people ages 50 to 80 who have smoked at least 1 pack per day for 20 years or 2 packs per day for 10 years, and who continue to smoke or have quit within the past 15 years. Screening is done with a low-dose CT scan. Lung cancer is a type of cancer that begins in the lungs. It is the leading cause of cancer death in both men and women. Several risk factors can increase your risk of developing lung cancer, including smoking. Smoking is the leading cause of lung cancer. Nearly 80% of lung cancer deaths are caused by smoking. Secondhand smoke is the third leading cause of lung cancer death in the United States. Radon gas. Radon gas is a naturally occurring radioactive gas that can cause lung cancer. It is the second leading cause of lung cancer in the United States. Exposure to asbestos. Asbestos is a mineral that can cause lung cancer. It was once widely used in building materials, but its use is now banned in many countries. Other carcinogens. Other carcinogens that can increase the risk of lung cancer include air pollution, silica dust, and chromium. Family history. Lung cancer is more common in people who have a family history of the disease. Age. The risk of lung cancer increases with age, with the majority of cases diagnosed in people over the age of 65. Gender. Men are more likely than women to develop lung cancer. Race and ethnicity. White people are more likely than black people or Hispanic people to develop lung cancer. Prostate cancer screenings. The American Cancer Society recommends prostate cancer screening for men ages 50 to 70 who have a life expectancy of at least 10 years. Screening is done with a prostate-specific antigen, PSA, blood test and/or digital rectal exam. Prostate cancer is a type of cancer that develops in the prostate gland, a walnut-sized gland that sits below the bladder in men. It is the second most common cancer among men, after skin cancer. Here are the 6 most common risk factors for prostate cancer. Age. Older age is one of the top risk factors for prostate cancer. About 6 in 10 men diagnosed with prostate cancer are aged 65 or older. Race and ethnicity. Studies show that African American men are more likely to develop prostate cancer. They are also more likely to be diagnosed with an aggressive form of the disease. Prostate cancer is rare in American Indian and Asian men. Family history. Men who have a father or brother with prostate cancer are at increased risk of developing the disease themselves. This is because prostate cancer can run in families. Lifestyle choices such as diet and exercise may also play a role in developing prostate cancer. For example, eating a diet high in red meat and processed foods may increase the risk of prostate cancer. On the other hand, eating a diet rich in fruits and vegetables may decrease the risk. Exercise may also help to reduce the risk of prostate cancer. Obesity is a risk factor for many types of cancer, including prostate cancer. Men who are obese are more likely to develop prostate cancer, and they are also more likely to develop an aggressive form of the disease. Androgens are male hormones, and they play a role in the development and growth of prostate cancer. Men who have high levels of androgens are at increased risk of developing prostate cancer. Are you over 40 and living your best life? Share your inspiring story with the world and spread positivity in the comment below.